Hi there, I'm Don Spillane, President of Designing Financial Solutions, introducing another in our series, The Essentials of Business Planning. And today it gives me great pleasure to introduce Jim Morrison, President of James M. Morrison Insurance Services, and he's going to discuss group health benefits. And today Jim's going to discuss challenges, planning and implementation, the Affordable Health Care Act, vision, dental benefits, and concluding comments.
Well, obviously there's the complexities of the ACA. It's extremely complicated. The rules seem to be constantly changing and evolving. Of course, there's the impact on health insurance, the affordability of health insurance, the costs continue to rise. And then, of course, lastly, the compliance component. It seems like employers are responsible for doing more and more and more things to be compliant with the new laws. It can be an extreme high amount of paper. We do have several technology solutions to simplify that process, automate and streamline, and that's definitely the trend of the marketplace right now. So the first step would be to sit down and interview the employer, determine what their goals are, desires, budget, kind of give them a lay of the land of what the rules are that are going to be applicable. And then we'll capture census data, shop the marketplace, and then basically show them everything that's available that fits within their goals. So sure, most of the time it's a simple spreadsheet in the beginning, and it's going to have the employee's name, date of birth, date of hire, typically home zip code, and then that same information for their dependent. But we do have electronic capabilities to do it online. It typically isn't as accepted, so most of the time the employer just pulls it from multiple reports, a payroll database or some other database, and then provides it to us. But then once we go into the implementation process, most of the cases are, about 80% of the time, we're doing all electronic enrollments, benefit administration, etc. So like every other law, there's people that have come out ahead and there's some people that are negatively impacted. The people that are coming out ahead are those that had an unhealthy population. They possibly had certain demographics, meaning that they might only had one child, a spouse maybe younger, because most of the time in cases with employers under 100 employees, it's now specific age rated. So the employee's age is taken into account, the spouse's age is taken into account, and then the number of children that they have is all taken into account. Those are then added up for a total premium. So if you have a larger family, you can be negatively impacted. If you have 3 kids or kids over the age of 20, rates are going to be higher. If you have only one child, your rates potentially could be lower. The downside is that if it's a really healthy company, they were doing everything right, they don't get those advantages or discounts anymore. Everything's community rated in the under 100 market. So that basically means healthy or unhealthy, you pay the same rate for the same plan as anyone else. If you're a 35-year-old person on a gold PPO, that's the rate. Doesn't matter if you're extremely unhealthy or extremely healthy, the rate is the rate. Dental and vision programs have basically become a popular option to consider. There are, because of the ACA, embedded pediatric dental and vision plans, so those are built into most of the Affordable Care Act compliant plans now for kids under the age of 19. However, in addition to that, many employers will typically offer a group dental or vision program as well, and they can be a complement to either the ACA pediatric dental and vision for those under 19, then of course for the needs of an adult. Count on a good broker. A good broker can make a world of difference in the complexity, compliance, competitiveness of your program, the communication of your benefit program, and basically take headaches off you and your staff. Lean on a good broker like ourselves. We'll make the process much easier on you.
Thank you for watching. Contact us for more information. We offer a free 1-hour consultation.